What if a small detail written on a card you have probably carried your entire life could reveal something about your health risks after 60, your blood type? But before you jump to conclusions, understand this. Your blood type is not your destiny. It does not decide how long you will live. It does not predict the exact disease you will get. And it certainly does not replace medical checkups. Decades of research involving millions of people show blood groups can influence certain biological patterns, especially clotting, cardiovascular health, inflammation, and some disease risks. The difference is not a guarantee, it is a signal. And after 60, signals matter. Aging is thousands of small biological changes happening silently over time. Today we'll look at what science actually knows about blood types O, A, B, and AB, what risks may be slightly higher, what advantages may exist, and most importantly, what you can do starting today to protect your health. Your genes may load the gun, but your daily habits often decide whether it fires. Welcome back. If you are over 60, you already understand something younger people often ignore. Prevention becomes more valuable with every passing year. The goal is not to become obsessed with every possible health risk. The goal is to understand your body better, recognize warning signs earlier, and make smarter choices. Your blood type is one small piece of a much larger health picture. Other factors are often far more powerful. Blood pressure, cholesterol, blood sugar, physical activity, sleep quality, diet, stress levels, and family history. The ABO system affects molecules on the surface of blood cells and other tissues. These differences can influence how your blood behaves, especially in clotting and immune response. So let's examine what researchers have found. If your blood type is O, you are part of the largest blood group worldwide. Research shows people with type O tend to have lower levels of certain clotting factors, including von Willebrand factor. Lower levels may contribute to a lower statistical risk of some clot-related cardiovascular events compared with A, B, or AB. That sounds like good news, and in many ways it is. But lower risk is not no risk. A person with type O can still develop high blood pressure, blocked arteries, heart disease, diabetes, or stroke. Your blood type may slightly influence your starting point, but your lifestyle determines much of the final result. After 60, one big mistake is becoming comfortable because past health was good. Aging diseases often develop quietly. You may feel fine while important changes happen inside. That is why regular monitoring matters. If you are type O, pay attention to digestive health. Some studies associate type O with a higher likelihood of certain stomach-related conditions, including Helicobacter pylori infection. H. Pylori may be asymptomatic but can lead to gastritis or ulcers. The message is not that type O people will have stomach problems, but that ongoing digestive symptoms or a history of ulcers should prompt testing and discussion with your healthcare provider. Also be medication aware. Many over 60 adults use pain or anti-inflammatory drugs that can irritate the stomach lining. Talk with your doctor about safer options and never stop prescribed meds without advice. And keep your body moving. Activity is one of the strongest predictors of healthy aging. Daily walking, strength exercises twice weekly, balance work, and stretching. Movement remains one of the best medicines. Now blood type A. Compared with type O, people with type A and other non-O groups may have slightly higher levels of some clotting proteins. That does not mean type A individuals will develop heart disease, but statistically there may be a small difference in risk. After 60, small differences matter when combined with other factors. Blood pressure, cholesterol, blood sugar, activity, smoking history, sleep, chronic stress, and family history. One area every type A should prioritize is stress and cardiovascular health. Chronic stress keeps hormones like cortisol and adrenaline elevated, which over time can raise blood pressure, worsen sleep, increase inflammation, and disrupt metabolism. For adults over 60, stress management is part of protecting the heart. Simple habits matter. A 10-minute breathing exercise, a daily walk outside, time with family or friends, learning something new, and reducing constant exposure to stressful information. These small actions, repeated daily, influence long-term health. Type A should also practice smart health monitoring. Check blood pressure regularly and discuss cholesterol testing, blood glucose testing, kidney function, and other tests with your provider based on personal risks. Aging well is not about avoiding every problem. It's about finding problems early when they're easier to manage. Next, blood type B. Type B is less common in many populations, and evidence linking it to specific patterns is more complex. Many claims about type B and special diets are not strongly proven. Science does not support the idea that your blood type tells you exactly what to eat. A healthy diet benefits everyone. Researchers continue to study how blood groups interact with immune function and inflammation. Chronic low-level inflammation is associated with many age-related conditions. The good news is many anti-inflammatory habits are under your control. Regardless of blood type, build an anti-inflammation foundation. Eat more whole foods, vegetables, fruits, beans, nuts, whole grains, fish, and quality proteins, and reduce ultra-processed foods, excess added sugar, excessive alcohol, and highly processed snacks. Protect muscle. Muscle regulates blood sugar, balance, mobility, and independence. Resistance training adapted to your ability is one of the best investments. Chair squats, light weights, resistance bands, or walking uphill. Aim for progress, not perfection. Pay attention to unexplained symptoms. Don't automatically blame everything on aging. Persistent fatigue, weight changes, unusual pain, digestive problems, or memory changes deserve attention. Now, blood type AB, the least common ABO group. Because it has characteristics of both A and B, researchers have looked for unique patterns. Some studies link AB with certain differences in cardiovascular and cognitive health compared with O. But association is not prediction. Having AB does not mean you will develop a disease. One area to focus on after 60 is brain health. Protecting cognitive function is crucial. The same habits that protect blood vessels protect the brain. Control blood pressure, manage blood sugar, stay active, maintain healthy cholesterol, sleep well, and keep learning. The brain responds to how you use and protect it. Sleep is one of the most underestimated tools for healthy aging. Many accept poor sleep as inevitable, but chronic poor sleep deserves attention. During deep sleep, the body performs maintenance. The brain organizes memories, tissues repair, hormones regulate. Consistently, too little sleep harms concentration, mood, metabolism, and immune function. Aim for a consistent sleep routine, similar bed and wake times, fewer bright screens before bed, a comfortable bedroom, and avoiding heavy meals close to bedtime. Small improvements add up. Another factor many overlook is the Rh factor, the positive or negative after your blood group. Most people are Rh positive. Rh matters critically in pregnancy and transfusions. Researchers are still studying other links, but current evidence does not show Rh status determines your future health. Practical advice: know your complete blood type, ensure your medical records are accurate, and focus on proven health measures. So does blood type really matter? Yes, but probably not in the way many think. It is not a fortune teller. It is one small biological characteristic among thousands. Think of your health as a large puzzle. Your blood type is one piece. Other pieces are much larger: daily movement, food choices, sleep, relationships, medical checkups, and your ability to adapt and learn. Those pieces usually have a much stronger influence. Regardless of O, A, B, or AB, follow 5 rules of healthy aging after 60. Rule 1. Protect your heart. Know your blood pressure, cholesterol, and blood sugar. Do not wait for symptoms. Prevention works best before problems appear. Rule 2. Protect your muscles. Strength supports independence. Train your muscles, walk regularly, and improve balance. Your future mobility depends on what you do today. Rule 3. Protect your brain. Keep learning, read, challenge yourself, and have meaningful conversations. Rule 4. Prioritize sleep and recovery. Create consistent sleep habits, reduce late-night screens, and allow your body time to repair. Rule 5. Stay connected and proactive. Maintain social ties, manage stress, keep up with recommended screenings, and discuss your personal risks with a healthcare provider. Your blood type can be a useful data point. Use it to inform conversations with your clinician, not to replace them. Small, consistent habits matter far more than any single genetic label. Start today. Check your numbers, move more, build strength, eat mostly whole foods, sleep better, manage stress, and stay engaged with life. Your genes may nudge the odds, but your daily choices shape the outcome.